Imagine you're halfway through your shift. Your patient was talking and laughing with you an hour ago. Now they're quieter, they're breathing faster, their heart rate has increased. Something doesn't feel right. Would you recognize the warning signs before it's too late? In today's video, I'm going to teach you exactly how nurses identify patient deterioration early, what to assess first, and when to escalate your concerns. These are skills every student nurse, newly qualified nurse, and experienced nurse should practice. Let's get started. Welcome to Nurse IQ. Here we learn nursing smarter, practice safer, and save lives. If you're passionate about becoming a more confident nurse, subscribe and join our growing community. What is patient deterioration? Patient deterioration means a person's condition is getting worse. Sometimes it happens suddenly. Sometimes it happens gradually over several hours. Your job as a nurse is to recognize those changes as early as possible. The earlier deterioration is recognized, the sooner treatment can begin. Remember, patients rarely go from stable to critically ill without giving warning signs. The key is noticing those signs. Let's look at the warning signs every nurse should recognize. Respiratory rate. This is one of the earliest indicators of deterioration. If your patient's respiratory rate suddenly increases, do not ignore it. Always count the respirations properly rather than estimating. Let's talk about oxygen saturation. Is the oxygen saturation falling? For example, here is dropping from 95 to 89. Are they requiring more oxygen than before? Always check the target range. A rising heart rate may indicate pain, infection, dehydration, blood loss, anxiety, or another underlying problem. A very slow heart rate can also be concerning depending on the patient and the clinical picture. Look for trends, not just a single number. Low blood pressure can indicate poor circulation. A sudden drop should always prompt further assessment. Is the patient more sleepy, more confused, less responsive? New confusion is an important warning sign that should never be ignored. A fever may indicate infection. A very low temperature can also be a sign of serious illness. Reduced urine output can be an early indicator of poor organ perfusion or dehydration. When assessing a patient, look at their skin. Is the patient pale, cold, clammy, mottled, blue around the lips? Skin changes often tell you more than numbers alone. Whenever you're worried about a patient, think ABCDE. A. Airway. Can they speak? Is the airway clear? Any obstruction? Treat airway problems immediately and call for help if needed. Let's assess breathing. First, check the respiratory rate. Count the breaths for 1 full minute. Next, check oxygen satisfaction with a pulse oximeter. Assess the work of breathing and chest movement. Listen for abnormal breath sounds if needed. Provide oxygen only if indicated and escalate concerns promptly. C stands for circulation. Let's check the pulse. Feel the radial pulse here. Next, check blood pressure on the arm. Check skin color, hand temperature, and capillary refill. Finally, look for signs of shock. D is for disability. Let's assess consciousness. Use your local assessment method. Check for new confusion. Check if pupils are equal and reactive if appropriate, and check blood glucose when indicated. E stands for exposure. We look for bleeding, rashes, pressure damage, swelling, surgical wounds, and signs of infection. Remember to maintain the patient's dignity and warmth throughout the assessment. Many hospitals use NEWS2 to help identify patients at risk of deterioration. NEWS2 considers rate, oxygen saturation, temperature, blood pressure, pulse, level of consciousness or new confusion, supplemental oxygen. Remember, NEWS2 supports your assessment. It never replaces your clinical judgment. If your patient looks unwell, trust your assessment and escalate your concern. Once you've recognized deterioration, communicate clearly. A useful structure is SBAR. Situation: I'm concerned about Mr. Smith. His respiratory rate has increased and he's becoming confused. Background: he was admitted with pneumonia yesterday. Assessment: respiratory rate is 30, oxygen saturation is below his prescribed target despite treatment, pulse 120. I'd like you to review him urgently. Clear communication saves time and may save lives. Avoid these common mistakes: ignoring subtle changes, focusing on only one observation, failing to reassess after an intervention, delaying escalation because you're unsure, poor documentation, never think, I'll wait another hour. If something concerns you, act. Let's recap. Watch for early warning signs. Use ABCDE. Use NEWS2 where appropriate. Communicate clearly using SBAR. Document accurately. Reassess regularly. Escalate concerns promptly. Remember, the patient often tells us they're deteriorating before the monitor does. The best nurses notice those changes early. If you found this helpful, don't forget to like this video and subscribe to Nurse IQ for weekly nursing education designed to help you become a safer, more confident clinician. Next week, we'll cover how to perform a complete neurological assessment and the warning signs every nurse should recognize. Until then, learn nursing smarter, practice safer, and save lives.